Hello and welcome. Good afternoon, everybody. This is Tim Bentley. I'm the Advertising and Marketing Manager for Tucson Medical Center. And we are live today with Emily Rich, an occupational therapist at TMC Outpatient Therapy. And this is another segment, another installment of our persistent pain series that Emily and her team are putting together for us. We're going to talk about the psychosocial aspects of persistent pain today. Emily, I'm going to turn this over to you in about 30 seconds, but I want everybody to know if you're watching this live today on August 24th, that you can type in a question in whatever platform you're watching, either on Facebook or YouTube, and I'll pass that along to Emily and her crew. If you're watching this on tape delay, perhaps you're watching it on YouTube or Facebook, you can also put those questions into the comment section, and it'll take us about a day to get those to Emily, but we can answer those for you. Emily, I'm going to turn it over to you to introduce the program, and I'm going to drop out, but I am in the background if you have any questions.
All right, sounds great. Well, welcome. We've got a couple of folks here in person, and then all of you joining online. Welcome. We're excited to have you. This is the last in this first series of our program on persistent pain. And we've been working through this for the last couple of months, and then we will restart this series again. So if you missed lectures before that, don't worry about it. We'll do those again. So today we're going to be talking about the psychosocial aspects of persistent pain. Sometimes we call that like the mental health pieces, or these psychological and also the social implications of having pain that lasts. So we'll talk a little bit about the neuroscience, sort of the brain understanding of pain and mental health. We're going to look at some strategies and lots of ideas for how you might be able to help your pain from this perspective. And then lastly, we will try a practice together, and then we'll have lots of time for a question and answer.
I didn't get any paperwork.
He's going to bring you the copy of the PowerPoint in just a minute. Yeah, he just, or maybe Geneva could grab that one for you whenever. All right, so how does psychosocial factors, or some of these psychological and these social factors, have to do with our pain? Well, our emotions,
Well, don't give me yours.
our attention, our thoughts, and also stress affect the neural or the brain pathways that can facilitate or increase pain levels. And sometimes we look at this as a cognitive emotional sensitization, or basically we feel sensitized, and our pathways to pain are more sensitive to some of our thoughts and also our emotions. And so this can lead to what we call like top-down disinhibition of pain, which in other words basically means facilitation of pain. It's not inhibiting, it's not stopping those pain signals. And so there is this relationship that's bi-directional between our mental health and chronic pain. In other words, people who have more anxiety, more depression, different kinds of mental health disorders are more likely to have chronic pain. And understandably, if you live in chronic pain, you're more likely to have some of these mental health symptoms that we see, right? And so these are a few of those kind of diagnoses that we might see: depression, anxiety, a history of substance use disorders is more common in experiencing chronic pain. And then also people with a history of trauma, which might include sexual trauma and violence, those kinds of things. That's not uncommon. It's likely due to what happens to our nervous system when we've experienced trauma. So it's all back to our physiology of our body. And so there is what we call a fear avoidance model of pain. And this explains how our psychological processes can result in acute or short-term pain that can then lead to this persistent pain and functional limitations or disability. So what we call sometimes negative cognitions, those might be negative self-statements. If you want to join us, you're welcome to come on in, just so you know, you don't have to register. And these statements can be abstract, they can be intrusive, hard to get out of your head, and challenging to disengage from, right? They're kind of really consistent thoughts. It might be an avoidance coping strategy, actually. So we're trying to limit that processing of challenges emotionally and also body-based responses. And we might do that by having these persistent thoughts. And this might lead to fear, understandably, right? If we have these thoughts in our mind that I'm never going to feel better, this pain is never going to go away, my life will never be the same. Those contribute to fear, understandably. Thank you so much, Jake. And for sometimes we use this word catastrophizing. And some people have a lot of problems with that word. It's not my favorite word. I don't use it a lot. But if you see that word catastrophizing, it's basically something that is of whatever size becomes catastrophic, right? It becomes so big, it takes over everything else. And this is sort of like anticipating the worst possible outcome. Therefore, it has more attention on the pain, right? We're going to be more focused on it, or sometimes people will call it hypervigilant, being really aware of that pain. That's kind of all that I can think about. And then I might avoid more activities, avoid movement. And it's important to note this isn't necessarily a sequential process where A leads to B leads to C, but these things all often happen with this fear avoidance model. So here's a picture that depicts this, where pain may cause and pain may be intensified by our thoughts, our emotional responses, our activity or our avoidance of activity, and then our subsequent functional limitations and deconditioning. So you can see how these all interconnect and relate to each other. And then here's another picture that shows on the left side how this is common. That, we have pain, it becomes really big, it leads to fear, we might avoid, but it's not as productive of a coping strategy, right, as if we kind of try and stay on the right side of this picture, especially in those early pain responses. It's really common for it to become big, but how can we recognize that this is actually really normal for the body? If I have pain, it's a really normal response for me to be concerned. It's an alarm bell, right? It's a biological thing that happens. So the goal being we can shift to this right side, recognize that it's a warning sign, confront that fear and the pain, and then work toward recovery. And part of this includes knowing and helping the body to know that it is safe because it's in that kind of fight or flight state. So this is a model that sometimes therapists use in terms of better understanding are different aspects of psychosocial elements of pain. So we might assess, this big picture of a person's life, including the type of pain, the body factors, such as using or discontinuing use of a body part, our exercise capacity, compensatory patterns, and more. And we also look at the thoughts and beliefs that people have about their pain, those emotional factors, behavioral factors such as avoiding activity, or persistence, where somebody pushes through their pain, right? And this might result in this boom and bust cycle where I feel good, so I push through and I do everything, and then I crash. Or sometimes we call it yo-yoing. And usually over time, that results in somebody doing less and less. So trying to find that balance of what is the right amount to push and what's the right amount to respect the pain. Other factors include the social environment, such as where you live, your partners, your family who lives in your household with you, prior treatments that you've had that have been successful or maybe that haven't been so successful, and your beliefs about those. And then finally, and maybe most importantly, is a person's motivation for change, right? So I think as therapists, most of us and everyone here understands that it's not always the right time for somebody to address their pain, right? We have to be in the right place psychologically and physically. And everybody has a process of acceptance and, being prepared and ready to kind of work on things in different ways. And some people aren't ready for rehab. So, considering in 6 months to a year, if that might be a better time for you. What is this not saying? That pain is psychogenic or that pain is all in your head. This does not mean that it's in your head and not real. It doesn't imply that it's simple or straightforward or easy to change. If that was the case, we would definitely not have the epidemic that we have of chronic pain in our country. But it does mean that there's some factors that are more within our control than maybe some other factors. And so in my personal and professional experience, I want you to have as many of those self-empowering tools as possible. That's the goal of this lecture. All right, so a little bit more into the specific brain science here. Most of us are familiar with the phrase fight or flight and rest and digest. It comes from your autonomic nervous system. This is what regulates our subconscious ability to do all the things in our various organ systems, like changing your pupil size, salivating, regulating your heart rate, your breathing, and your digestion. If we're more in that fight or flight state on the left side here, you might not realize if your body spends more time there, but pain often leads to that. When we're having this signal going off in our body that says danger, danger, a lot of times we spend more time in fight or flight. And so you'll see it's much harder for the body to self-regulate if we can't let our guard down and digest our food appropriately so we can get our nutrients from it. If we can regulate the circulation of blood and control our breathing. When our body releases adrenaline over the long run, this can result in blurred vision, eye tics, or feeling fatigued in your eyes. It might lead to jaw tension from clenching your teeth. You might feel dizzy or jittery, and you might have pain in your diaphragm if you're breathing rapidly, but you're not performing any physical activity. Because there's excess oxygen in your system when you breathe in that way. So just a little insight of the physiology happening behind some of these fear responses. So therefore, pain can cause the autonomic nervous system to be in more of a state of stress, and stress can subsequently cause more pain. Signs of stress might include shallow breathing, depression, tight muscles, anxiety, and poor sleep. So as you might guess then, relaxation is very important for coping with pain because pain is not only stressful in itself, but stress exacerbates and maintains pain. So relaxation is very helpful in calming your nervous system, which often becomes sensitized when pain persists for a long time. And so our reaction to go in that fight or flight state might be quicker and more easily triggered. And relaxation also boosts your body's natural pain regulators, such as endorphins, which we call like feel-good hormones. Relaxation is different from mindfulness, but mindfulness is an awareness through intentionally paying attention to the present moment. And here's the key, doing this non-judgmentally. So we want to separate the subjective or our personal experience from the factual or objective experience. Negative thoughts drive negative feelings, which can sensitize our nervous system and increase our pain. So thinking very negatively about pain, which is honestly a very normal response, right? It's not a pleasant thing in our bodies. And some people will call that, again, pain catastrophizing. It's one of the strongest predictors that short-term acute pain will become long-term persistent pain. And so rather than this man saying, pain is bad, I need to get rid of it, he's able to reframe to be curious. What does this sensation feel like in my body? Without judging whether it's good or bad, and trying not to develop a significant adverse emotional response to it. So if we create this awareness of a sensation without judging it, we will experience less anxiety and depression and maybe not feel a need to fix it, right? If it's not bad or wrong, then we might not feel like we need to fix it. And therefore, it might reduce our perception of pain, tension, and stress. There's a lot of science around mindfulness, thankfully. So I'm not just saying this because mindfulness is all the rage, it's really popular right now, but the science actually shows us that brain activity changes with mindfulness and with meditation. This does not have to have any religious connotation. It's purely separating fact from our subjective experience. So we see more brain activity in processing sensory information and less in the region associated with emotion in people who meditate. So they're kind of judging that sensation versus, or not judging, but analyzing or assessing the sensation versus the emotion going with it. We also see decreased pain intensity compared to a placebo intervention, with less activity in the part of the brain where we think and evaluate sensory information. And then we see improvements in depression levels and quality of life with mindful meditation. And it teaches your brain to experience pain with less distress associated with it. So there's specifically, we change in sustained attention, the area of the brain that detects mind wandering, the ability to switch attention from one thing to another, and then also the area of the brain that redirects our attention to something that you choose. So these people have more gray matter in their brain, which helps with processing and emotional control. And finally, we see stress reduction in mindful meditators. So what if you're not a master meditator? There's still so much that you can do. You don't have to devote your whole life to meditation to benefit from this idea of mindfulness. So let's go through a little bit of what might be able to help. So big picture, sorry, I changed my slides. These are a little bit different because the computer was not working correctly this morning. But big picture, we have cognitive behavioral therapy, which is something a lot of people have heard of. It has some more negative connotations recently, but we have what's called these third wave therapies now. And so I'm going to talk about some of those in a little more depth because people aren't as familiar with those. They're newer. All right. So this is an element of dialectical behavioral therapy. And it's this idea of a rational mind, which uses logic and reasoning, compared to an emotional mind, which is emotionally driven. And then in the middle somewhere, there's this wise mind, right? So it's where we see this balance of emotion and rationalization, where they create this wise mind. And we say that's living from mindful awareness. It's not getting stuck too much on the emotion of something and not leaving the emotion out and being really logical, but taking those two things into account and creating an intelligent perspective of those. All right, so here's cognitive behavioral therapy. And it's this overall concept of assessing what our thoughts mean, trying to change our thoughts about something. But we now have these third wave therapies, which are dialectical behavior therapy, or DBT, acceptance and commitment therapy, or ACT, and mindfulness-based cognitive therapy. These are more about the process, the context, and the function of how a person relates to their internal experience. So concepts like metacognition, which means thinking about my thinking. What is my thinking doing for me? How is that serving me or not serving me, right? Acceptance of things, if I'm going to live with a medical condition, how do I get to a place of acceptance? Is that possible for me? Mindfulness, your personal values. What do you value in your life? How does that fit into this? And spirituality. All of those are incorporated into these kinds of interventions. And so I'll go through these briefly now. So DBT, one concept there, it's especially focused on how we feel strong emotions and helping to understand and accept those feelings. So one concept is diffusing from sticky thoughts or emotions that sometimes are hard to get out of our heads. So this shows how you might take a thought like, I'm stupid, notice that thought, and then followed by noticing that you're noticing that thought. Okay, so that's sort of the step of zooming out and noticing it, and then noticing what you are noticing about it. So this is that idea of metacognition, and we can hold our thoughts lightly and recognize that they're just thoughts. So this concept is similar to clouds in the sky, where you might imagine a windy sky where you can see all the clouds passing by, and you try and notice your thoughts. Without judging or analyzing them, imagine your thoughts are written on clouds, one thought for every cloud. You can summarize your thoughts with a couple of words, and then imagine how the windy sky makes the clouds go away. Your thought slowly leaves the sky, and you can keep being aware of the thoughts in your mind and continue imagining every other thought on a cloud that is floating away. So that's the idea of diffusing from sticky thoughts. Acceptance and commitment therapy, I think is, an excellent modality for chronic pain. And the main difference between ACT and DBT would be that DBT leans toward a more educative approach, while ACT emphasizes a more experiential one. So this might help you decide which type of therapy, if you decide to pursue it, when you might lean toward an educational approach or an experiential thing to learn it. It's different from traditional CBT, as instead of trying to change a negative thought or a destructive thought, ACT recognizes that pain and discomfort are a part of life. So we must accept all thoughts rather than to change them, and work to get comfortable with these if we wish to live a happy life. It includes modalities like mindfulness, understanding your values, using exercises and metaphors to learn how to change our relationship with various experiences and thoughts. And like I said, I found it to be a really helpful approach for a lot of my patients with pain. A concept within this is psychological flexibility, which is the goal to help decrease our perseveration or getting stuck on certain thoughts. So we start to see thoughts as mental events rather than as facts, which lessens their impact on us. In other words, we don't as easily buy into the negative story around our pain. And so this is especially important in overcoming the upsetting emotional impacts of pain and disability like depression and anxiety. And then here's a few other ideas of activities that might be done in ACT. So again, you see that diffusing from sticky thoughts, commitments, and I love this quote by Robert Frost: the only way out is through, right? So it's not around, or we have to kind of go straight through that. Mindfulness-based stress reduction is a heavily researched intervention for the general population. And the idea is that it uses mindfulness to teach healthy responses to stress. Okay, so this is used in all kinds of different diagnoses in just, the general population. The aim is to decrease avoidance patterns and unhelpful coping skills, and instead developing the skills to know what to do when a stressor arises. So there are many studies with positive outcomes in persistent pain with increased physical functioning, vitality, or the sense of feeling alive and energetic, depression, acceptance, improvement in pain levels in both the short term and the long term. The great thing about MBSR is you can find online programs, lots of different groups, well recognized. Universities have these, really easy to find this online. And I think they're still doing some in-person sessions in groups. You just might have to find one close to you. Self-compassion is my favorite approach for self-regulation from a psychology perspective. It's gentle and validating, and it has substantial research evidence for all kinds of health parameters. We know that if we have persistent health symptoms and change in function, it's very understandable, and actually it's normal, to have an emotional response to that. And so self-compassion has 3 elements: mindfulness, or being aware of the present moment; common humanity, or normalizing your experience as part of the shared human experience; and self-kindness, where you work to comfort yourself. There are a couple of free resources here that I'll show you on the next slide. And you can look at this as sort of a mantra. So for example, mindfulness. This is really hard right now, right? Like breaking away from that, everything is bad and I'm just in my head, but just to step back and say, this is really hard right now. The second part of common humanity, it means struggling is a part of life, right? Everybody has some sort of struggle in their life. It might not be the exact same as mine, but this is a normal human experience. I'm not really weird and different and alone. And then the self-kindness of like, may I be kind to myself? And so a lot of times that can help us to zoom away from that acute crisis in the moment. Here's a free self-assessment that you can go online and take a peek at. Kristen Neff is sort of the guru of self-compassion, and she's got this great questionnaire. You can kind of find out how self-compassionate am I, or hard on myself, right? Which I think we all can use more self-compassion. And then she also has guided practices that are audio meditations and exercises that can be performed anywhere as well. So they're really lovely. There's a compassionate body scan that is so different than any other body scan. So a lot of people have tried a body scan and they find that they focus more on their pain or it's uncomfortable. And hers is just so lovely. So I really encourage you to try that one. And then here are those free those resources that you can purchase. She has written several books, and this mindful self-compassion workbook is something that you can work through yourself. You don't need a therapist to do it, or you can work with a therapist. And it has several practices, really a lovely guide to sort of get you through that process. And then she's got a couple of books here too. All right, so biofeedback is just feedback about your body. And that can be helpful in learning how to self-regulate and understand our body's responses to different things. So for example, you'll see heart rate variability here, which is on the bottom. And we measure the depth and the length of each breath and how it's affecting your heart rate. Basically, the idea is if you have higher heart rate variability, your body can more quickly switch into that rest and digest mode and switch into that fight or flight as needed versus getting kind of stuck in that fight or flight mode and it being more challenging to switch back. So we also look, and you can see the picture here of frustration, what your breathing looks like versus appreciation. And so how changing that emotional response actually changes the physiological response as well. We also measure hand and foot temperature as a measure of circulation and blood flow, because if we're more in a fight or flight state, our hands and feet are usually colder, our circulation isn't as helpful. So that can be an indicator for us. And then we look at muscle activity. For example, is my jaw clenched? Am I making fists? Are my shoulders up to my ears, right? And the goal is ultimately independence in these things in daily life without need for a device or a computer system, right? This is just learning how to understand and kind of listen into your body. There's two apps here that I like for the phone, Juva, which is only on Apple devices, and then Welltory. Juva is free and was created for chronic migraine sufferers by a neurologist, I believe. It's an excellent app. And these can be a beginning to biofeedback and understanding more about your body on a day-to-day basis. Oh, yeah, that's okay. On that note, there's other ways that we can help to regulate our automatic nervous system and decrease our heart rate and inflammation while improving our digestion, our sleep, and our circulation. So breath work is one strategy to activate that parasympathetic or rest and digest response. And breath work is, I'm going to talk a little bit about in a couple of slides, but it's just basically playing with the breath, just seeing like as a science experiment, what can I do with my breathing? Also vagus nerve toning exercises like humming, singing, splashing cold water on your face, thinking about something that helps you to salivate, laughing, massage, all of those things can help with that rest and digest response. And then trying to help the nervous system when it does become overstimulated. So some people benefit from using these types of tools, such as noise lowering earbuds, not noise canceling, but lowering the volume or the intensity of the sound to decrease overstimulation. But I always put the caveat that using these in a short period of time, for example, when I go to the grocery store or the movie theater, because I know it's going to be too loud, versus wearing them all of the time, what we see is people actually become more sensitive, and it has sort of a negative effect. So using these, proactively in anticipation of something being too overstimulating or reactively in the moment. The other's a weighted lap pad, which can help as sort of like a weighted blanket, but it's a little more realistic in day-to-day life for that grounding proprioceptive input. A tight sheet. Some people like to tuck themselves in and get that feedback into their body. It's basically like telling the body you're safe, and giving that feedback there. All right, I mentioned a body scan earlier. A lot of people who have pain have had negative experiences with a body scan, but John Kabat-Zinn, which is one of the most famous mindful meditator people, suggests that this is actually the best for pain. So you can find his technique at health.harvard.edu. But in general, just looking at a body scan as a really helpful strategy for managing chronic pain. As I mentioned, Kristen Neff has a lovely one that I would highly recommend. That's free online. And then there's lots of other options as well. So I think finding the voice of a person is really important. It seems kind of silly, but I think if you're going to listen to this, it needs to be relaxing to you. You need to feel comfortable. And also the wording, the verbiage that speaks to you. Therapeutic journaling is the process of writing down our thoughts and feelings about our personal experiences. It's different from normal day-to-day journaling. So this is more of an internal process of expressing our full range of emotions, reactions, and perceptions to different difficult life events. And along the way, this can mean writing ourselves into a better emotional and physical health and a greater sense of well-being. So it allows us to sort through our thoughts and anything that happened throughout the day. It sort of gives the nervous system that energy a place to go, right? Especially those thoughts that might not be well received by others or that we might not want to speak out loud or might not be able to speak out loud. But if we can get those down and shred it, burn it, whatever you need to do. Sometimes people will write things and put them into the freezer, I'm going to take a thought and put it down and I'm going to put it away. Any of that, it just actually lets that energy and those feelings have somewhere to go. Can be really helpful. So the therapeutic writing protocol is listed here, where you actually write for 4 days in a row. That's really important, that you don't just write for 4 days total, but back to back for 20 minutes nonstop each day. And if you don't have anything to write, then you just say, I can't think of anything to write right now, right? But just keep going, keep that flow. And so the research strongly supports this journaling strategy for pain and chronic illness. Breathing is something we're all familiar with, but breath work specifically is the idea of changing, manipulating, playing around with the breath in a variety of ways. So there's a few ideas listed here. With that focus on extending our exhale tends to be more of that relaxation breathing. And diaphragmatic or belly breathing, I tell people put one hand on your chest and one hand on your stomach. Laying down is going to be the easiest to start, but you can do it sitting up too. And just working on trying to get that belly to come out or to rise as you inhale and that belly to fall as you exhale. What we know is this really helps the nervous system to go more into that state of rest and digest. And a lot of times we breathe more shallow and more from our chest and don't even know it, especially if we live in persistent pain. And then square breathing is something where you kind of trace a square, inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and then hold for 4 seconds. So lots of different strategies, but just finding what feels most comfortable to you. Slower breathing has been shown to help with self-regulation, decreasing pain perceptions, and reducing that fight or flight response. Emotional freedom techniques, often just called tapping, EFT. This is a really helpful book for specifically for pain. But basically what you're doing is you're tapping on acupressure points, and it allows emotions to sort of move through the body. That's the idea behind it. So it's very easily accessible anywhere that you are. If you're in a doctor's office, you need to run to the bathroom and you can do some tapping, but there's specific points, and there's a lot of resources out there on those. So some additional strategies for coping include progressive muscle relaxation, which there's lots of guided exercises for that. Incorporating mindfulness into your daily activities, right, all throughout your week. So mindfulness doesn't have to be sitting, with my feet crossed and my hands up here and humming or something, but, just as I'm eating my food, maybe I can think about, where did my food come from? Like, how many people were involved in the creation of this meal and getting it to me here? Tuning into the sensations, the feelings, all the different things that are involved in your food, rather than being on your phone, on your computer, watching TV, talking to somebody, right, as you're shoveling the food into your mouth, which is nothing that any of us ever do, I'm sure, right? Never done that. Never been doing my documentation and eating at the same time. Using distraction is very powerful. I think sometimes people think that we're minimizing, you just need to distract yourself. No, really what we're saying here is we want to turn down that pain signal. Jake presented on pain neuroscience at our very first lecture. And it's this idea that, the pain signal is coming in strong. And so we need to interrupt that pain signal. If we can do something about the pain, great. But a lot of times with persistent pain, we can't. And so how can we turn down the dial on that pain signal? And if I can use something really interesting that I'm really engaged in and I enjoy, that can really help with distraction. But I think distraction is taken not as seriously as it should be. So, and then guided imagery can be helpful, in grounding techniques, which is basically the idea of noticing a support surface below me, kind of like tuning into the world outside me and how I connect with that world, rather than getting stuck with my pain inside of me. So that could be a weighted lap pad or a weighted blanket. It could be walking barefoot, noticing the floor below you, really like feeling that support surface of your bottom in a chair, those kinds of things. As I mentioned earlier, trauma is quite common in chronic pain, and there's a lot of options and specially trained professionals who work in this area. So EMDR, eye movement desensitization and reprocessing therapy, is becoming rapidly more available, and more research in that area. And then somatic experiencing modalities can also be really helpful, basically where somatic means body. So a body-based therapy where you're, considering something that has happened, something that's challenging, and then thinking like, where do I feel that in my body? Not just where your pain is, but do I feel tightness in my chest, right? Do I feel my hands clenching? What am I noticing? And trying to help that energy to move through there. And then I highly recommend, if these things would be helpful for you, if you've had experience with trauma, to seek help from a trained professional. And Psychology Today is just one resource where you can search by insurance, location, specific issues or specialties, and more. So there's lots of resources, but if you need a therapist, Psychology Today is often a good place to start. And it's free. All right, so one concept to consider in reframing is, in Japan, broken objects are often repaired with gold. So the flaw is seen as a unique piece of the object's history, which adds to its beauty. And so consider this when you feel broken. We're almost done here, just a couple more. Social participation is highly, highly important, and studies definitely support the benefit of having people around us in terms of managing pain. So it can reduce psychological distress, Just even that perception of having someone on your team supporting you, the emotions and the hormones that are released when we're with people. And then in a study with college students, they used the following tools to successfully participate socially, and that was coping strategies, pain management, and adaptations. Leisure and hobbies, again, similar to distraction, I think should be taken seriously as a tool. And then I say, but not too seriously, right? We should be having fun with them. But thinking about what do I do? What do I enjoy in my day-to-day life? Have I lost my hobbies? And really considering what you might be able to pick up, maybe do something you used to do in a different way, or doing something brand new and finding ways to engage with that. Can help with coping and managing an illness in the long term, having more control over your pain, a different experience in your body compared to a sick body, right? Of like, I'm a person who does this, right? For example, I do Pilates, I'm a person who does Pilates, even despite the fact that I live with persistent pain. Knowledge creation that supports our adaptation to uncertainty. So that creative lens in our brains is really helpful in terms of being able to adapt and modify things, even when we don't know what's going to be next. It releases endorphins, helps with distraction, stress, well-being, and opportunities to relate with other people, right? That social piece. So I've listed some ideas here that are often well tolerated by people who live in persistent pain, such as crafts, knitting, crocheting, cross-stitch, painting, visiting museums, which often have a lot of benches and chairs to sit down, scrapbooking, card making, cooking, gardening. I highly recommend a raised garden bed if you live with pain. There's lots of adaptations that can be made to gardening. Puzzles and Sudoku, reading, and then bird watching. And we live in a beautiful place to be able to do bird watching. Catalina State Park is a fantastic spot. So when the weather's a little bit cooler, maybe. All right, so starting today, trying to use the word discomfort rather than pain. So changing that language of just, this is a sensation that I'm experiencing. You might think, what is the color of this sensation? Does it have a certain shape? How could I describe it without the word pain, right? Just engaging with it in a different way. Instead of the word chronic, you might have heard me, and we've titled this series Persistent. There's a reason for that. Just because you have pain on a day-to-day basis does not mean that it is going to be forever. And so changing the language often has a lot of power in terms of this is persisting, but it doesn't necessarily mean that it will never go away or that it won't change, right? It could change. And so this general idea of noticing physical sensations rather than focusing on the negative thoughts that result from the sensations. We were going to do a practice here, but I think let's skip this for now. You've got lots of resources where you could find those. And then again, some more resources here for you to look through, several different apps, as well as the two that I mentioned earlier of Juva Health and Welltory, and a website and videos. And then I'm happy to take questions. So here's my references and then questions. But anybody here in person that has questions, and then we'll go to the online folks. No questions? Okay. All right, Tim, any questions on your end?
You know what? Emily did such a good job that there are no questions. Very thorough. I will add that if anybody's watching this later than August 24th, 2022, to please leave a question in the comments of whatever platform you're watching it on, and we'll get back to you. But Emily, I think we're good. You want to give us maybe a heads up on you're circling back on this series. When do you anticipate that starting?
Yes, it's in my email, which I can't pull up right now on this screen. And Jake is in the other room. Maybe could you grab Jake, Geneva? I think it's going to be in 3 or 4 weeks, I want to say. Okay. But we're going to go straight through again. It'll be pretty much every other week. We'll do the same. I believe it was 6 classes, starting with pain neuroscience. And then we moved to nutrition. And then we did sleep, I believe, and then pharmacologic or drug interventions, exercise, and movement, and then the psychosocial pieces. So those are all of our categories. Maybe we can post them, Tim, if I can get the
We
dates
sure
for
can,
you.
and if
Okay.
you registered for a class in person, we'll
And of
We'll do that.
all this, which I am kind of
All right, we do have one question here. Go ahead.
Okay.
research. But what if you just decide to accept what's going on in your body when you've tried everything, physical therapy,
Mhm.
drugs, surgery?
Yeah.
I just can't walk.
Yeah.
I mean, it's getting worse.
Uh-huh.
And the last physical therapist, it didn't work.
Mhm.
And I've done many, many surgeries on my body,
Yeah.
so there's not going to be any more.
Yeah.
So acceptance, is that
Yes.
something that you're going to end up
Yeah.
doing in your life?
Yeah.
At my age, at 82, right?
Yeah. Right.
I'm going to accept that this with discomfort.
Yes. I love it. Beautiful. Discomfort. Uh-huh. Yeah. Yeah.
I mean, I'm just curious, somewhere
Yeah.
in there, just acceptance. I mean,
Yep.
because you can cry over it, but that's
Yep.
not going to do a bit of good. And so I decided it was time to try and take over this
Yeah.
pain. So I made a bunch of appointments. You were one of them. I'm
Yeah.
going to pain management, which I hate,
Okay.
but I'm going to try your place over here next week.
Okay.
And I'm going in with a negative idea, so I need to change that by next week.
Wow.
right?
You are just, I love it. You're implementing.
So I'm trying
Yeah.
to think of all the things I can do.
Yep.
But acceptance is somewhere in all that, isn't there?
Yep. Yep. So the question is, when you're an older adult and you've lived with pain for a long time, and where does acceptance lie, right? You've had surgeries, you've had therapies, and nothing else seems to be sort of like, there's no cure, right? It's
Oh,
like you
no.
still have the pain. Acceptance, exactly. And I think that's where that acceptance and commitment therapy is really helpful if you feel like you need someone to help you in that process. It sounds like you're doing beautifully, and just even, changing that wording right now, right? From I have this pain versus I have this discomfort.
Yeah, I'm gonna try that when I talk to people.
Yeah.
I mean, of course, I'm not the only one. I live in Green Valley. So of course,
Yes.
all my neighbors are, well, most of them are younger than me, but
Yep,
I
yep.
got some that are older.
Yeah. Yeah. And the piece, she mentioned too, like going to a pain appointment and being frustrated or like not really looking forward to it, right? Sort of having a negative outlook on it.
I'm gonna change that.
And I think too, when we go to a doctor's appointment or whatever type of appointment, a lot of times historically it's been, how are you going to help me? What are you going to do for me? You know everything, and I'm just here to learn. And I really encourage people to consider, like, we're partners in this, right? I'm coming to you with all the knowledge and all the understanding about my body that I have. You have a lot of knowledge, right, through whatever program, if you're a therapist or you're an MD, or whatever your skills are. And I think if we can communicate to the provider what we're really looking for, it can help a lot. But a provider's job is to do whatever they can to help you in whatever way they know how. And so if you walk in and they start talking medications and surgeries and procedures and whatever, and you're like, you know what, I'm just not interested. I think expressing that kind of early on and saying, I'm here for this sort of thing, right? And so that might mean like alternative modalities, or, what ideas do you know of from this perspective, of like integrative medicine, or is there a new therapist that I don't know about? Maybe there's a
Right.
physical therapist. Yeah.
I have neuropathy in my feet, so I go to a new doctor about once a year.
Yeah.
And ask that question.
Yeah.
Is there anything, and I do that
Yep.
faithfully for 15 years.
Yep.
Is there anything that can be done for neuropathy?
Yeah.
And basically the answer is no. 'Cause
Yeah.
there really isn't.
Yeah.
You can't do surgery.
Yeah. Yeah. Yeah.
But I'm just
Acupuncture
saying-
is something
I'm
to
just saying,
consider too.
Somewhere
Yeah.
in your lecture, I think acceptance has to be
Absolutely.
a little bit of it. But I
And
am gonna go through and read this right now. I can't read it.
yeah, get your glasses. But yeah, and I can give you a bigger version of it too if you'd like. But yeah, I think hopefully you heard in there too, right? That acceptance piece allows that nervous system to say, like, this is not a threat to me. I'm not trying to fix it. I'm not trying to change it. There's nothing wrong, right? Whereas at the beginning, when we have an injury and we have pain, that is our response. Like, something's wrong. I need to fix it. I need to do something about it. But when that pain persists, it's like, all right, this is just, this is a part of life. If that's the place that you're at with it, right?
Just about the walking, I keep thinking something's gotta get done to help it a bit.
Mhm,
But
mhm.
I like to volunteer, and I'm
Yes.
quit volunteering a lot.
Oh,
I can
man.
do the standing,
Okay.
but if it requires walking, within 3 minutes, I'm done.
Okay.
You know, and it's
Yeah.
not really pain. The legs just give out. You know, they just
Gotcha.
quit working.
Hey, Emily.
Yeah.
Emily, this is
Anyway,
this is
you have a thing. Go help your other people, okay?
Okay.
um,
Tim, what was that?
well, I heard she likes to volunteer. TMC welcomes volunteers of all capabilities. So if, maybe get her name or her email, and I'll send her some information about volunteering at TMC.
Yeah, if you're interested in volunteering here, we've got lots of seated types of volunteer opportunities too. And I think working with, an occupational therapist, a physical therapist, whatever, with that goal in mind, I want to volunteer. I'm not here for you to fix my pain. I want to volunteer. What can I do to be able to walk as I need to volunteer, or to be able to use an assistive device to be able to volunteer? And then that helps us as providers to say, oh, all the other ideas I have, like those need to go on the back burner because I'm concerned about what you are concerned about, which is being able to volunteer. So I think we can all help our providers in terms of telling them, what we're really looking for. So,
There was something online.
Hey, Emily.
Yeah.
Emily, my platform is alerting me that that we're going to end here in a minute. But I'm going to go ahead and sign up for the online. But you and I will talk offline a little bit. We'll post some of the information, and I'm going to suggest that we send some of your documents to the people that have registered for in-person classes. We can send PDFs to all of your registrants. Okay?
Okay. Sounds great.
Okay.
Thank you so much, Tim.
Bye, everybody. Good job,
Bye.
Emily. Bye.
We're good. If